Right, here we go. Welcome to another course on workforce planning. As it says there, the topic here is workforce planning. The course is course B, WRAPT Redesign. And this is session 1, which is scope and mobilise, and leads on from session 0, which was the overview to WRAPT Redesign. So if you've done that course, you know what this is about. But I'll start by telling you who we are and how we go about things. Before getting into what this session is about. So we are Carados. My name is Colin Lurie. I work for Carados. We're a management training and development company. We focus predominantly on building skills in frontline health and care managers of all types. And we focus largely on workforce planning, cost control, customer service and general management skills. We work also with Lancashire and South Cumbria NHS Foundation Trust and Health Education England to provide the WRAPT tool, which is the Workforce Repository and Planning tool, which we deliver along with our partners, the O1 Group. And that WRAPT team are here. I work with this team. We're an NHS-based training and development service, and we train and support the Workforce Repository and Planning Tool team, which is a workforce modelling tool which is available to use online and is free to anyone in health and social care. Links at the end. And there's a specific WRAPT modelling course which these guys in this photo provide and will be online soon. The approach we take to development is important to go over because we provide the tools and techniques for free. So these courses are available on YouTube for free. And we also provide the WRAPT tool, which, as I say, is a workforce modelling tool we provide for free. There's all sorts of stuff that is available on the WRAPT website and or on the Carados website. Which should give you all sorts of stuff you need to know from a tools and techniques point of view. The thing is, it's not much good just having the tools and techniques. You need to provide time and you need to take the time to practice this stuff yourself. So you need to look at these courses and spend the time practicing on these courses. So you need to bring that capacity and capability yourselves. And you also need to make sure that if you're using work time to do this, that you are very much linked into what your organisation and your executives and your managers want themselves, because there's no point starting this training and then stopping because something more important comes along. So it is important to make sure that workforce planning is something your organisation needs, that this is the approach that they want you to take to learning it, and that it will help solve a real executive problem. Otherwise, something will come along, like recently the vaccination program, for example, and will knock everything else out, and work won't be done. So it needs to be very much linked into your organisation. And then finally, you really ought to have a reason for doing this training and a chance, basically a reason to learn, a chance to practice, and something to prove success. So right at the tip of the pyramid is the project. You really ought to be working on a project while you're doing this. And certainly in this course, there'll be a number of sort of blue box slides where you'll be asked to think about the step we've just looked at or about to look at from the basis of your project. And please take the time to do that if you can. So that's our approach to development. So I'm going to talk about this module before getting into the actual stuff itself. So the theme is workforce planning. Overall in the workforce planning theme, we cover what it is, how to redesign it. We talk about how to use the WRAPT modelling tool, how to develop a plan. We talk about workforce hubs at system level, and we talk about frontline workforce planning skills. So there's lots of topics, but this is the topic of redesign. Of course, B, workforce redesign. And on that course, we are going to cover each of the different steps, as well as understanding the high-level redesign process, which we did in course B0. We're now going to look at how to set the project up to succeed, and then later on, we'll be looking at the current state, the future state, modelling the workforce and planning and implementing the change. As it comes to scope and mobilise, which is course B1, we'll be looking at how we work as a project, developing the challenge, engaging stakeholders, developing the project charter, and we'll be considering that lovely topic of information governance. So that's what we'll be covering in this session. As far as the plan program is concerned, we covered that in the overview. We are currently on B1 Scope and Mobilise, so you're pretty much at the start. Don't forget 5 main courses and then 5 sort of sub courses, which will hopefully make the program a little bit more broken up rather than massive sessions in the current and future state stuff. We talked last time about the WRAPT process. Important thing to note is we are going to talk about the first one here, the scope and mobilise step, which we'll be covering through this session. So we talked about the WRAPT process. We talked about the, in the overview, we talked about this is all about setting the project up to succeed. Whether this is a project which is just workforce, or whether this is a project where its workforce is being used as the driver for it, but we need to redesign everything, process, technology, organisation structures, estates, whether we need to include all of those together. Whatever you're doing, it's important to set the project up to succeed. And mobilisation is 100% critical. Every project that I've got involved in which has gone wrong because of mobilisation. I should probably stress that not every project I've got involved in has gone wrong, but when they have gone wrong, and where they go wrong, either catastrophically or in sort of specific areas, it's almost always because mobilisation has been done poorly. If you want to waste time, if you want to annoy people, if you want to be inefficient, if you want to miss the point, if you want to fail to include everybody that you should have included, then miss mobilisation out, because that's the sort of thing you risk here. There are 4 steps: developing the challenge, engaging stakeholders, agreeing the project charter, that's pretty much writing everything down, and then ensuring information governance. And these are the things you really need to do up front. As I talked about in the overview course, though, sometimes you don't get that luxury. Sometimes you get involved midway through, you're not at the start of the project. You get asked to develop the future state, and then you find that the current state isn't in place, and actually you find there isn't a proper project. Project I'm working on at the moment, this is exactly what's happening. It's often important to go back to the scoping and just try and make sure that what is in place in terms of governance, information governance, etc., is sorted out retrospectively, even if it wasn't set up at the start. So those are the 4 steps. So you are a workforce project. Now we are taking the view that you are a workforce project that probably sits within a redesign project. It may be that you're the full redesign project, and you can use this approach for either. We'll consider all different elements in case you are. In my experience, it's quite rare for you just to run a workforce project, because we quite often have a workforce problem and we have to set up a project to address that workforce problem, and it's often then seen as a workforce problem. So somebody will say, we've got to redesign stroke services because we don't have enough nurses, we've got to redesign mental health services because we don't have enough whatever, psychologists, psychiatrists, nurses, doctors, whatever. Then you may need to do the full redesign. The overall project that's been set up may be already a paragon of excellence. There are some people who are just really able to set up projects. They've been proper project management trained, they understand governance, and they'll set the project up properly from the start when you get involved. Or you might get involved in something that is a complete shambles and you'll have to address it. If there is already a program, your job is to find out everything about it. Understand what the scope is, what the aims are, what the activity, the plan is, in terms of activity and timescales. Find out what the project structure is, how you fit within that. It would be great if that is in place, because then you can be very clear on what you need to do and you've got people you can agree what your requirement is. But if there isn't a program, you'll need to set up everything from scratch. So you'll need to set up a mechanism for governance. You'll need to set the scope. You'll need to get agreement on the aims, etc., of the whole program, and the requirements to hold the team to account. If you're going to do that, what you're probably going to need is to make sure there is some sort of program board, making sure there is a workforce board that feeds into that program board, and that there is a workforce ops team, that's the doing team, that feeds into that workforce board and into the program board. So I guess the point of this is that scoping and mobilising a workforce program is about making sure that the workforce program sits within the overall program. It is a project in its own right, and you need to set that project up to succeed. And we'll talk about that in a second in terms of scope, aims, plans, and structure, etc. So, first activity. So these boxes will come up occasionally for you to think about what is your project like, and you'll probably ignore them and jump straight onto the next bit. But if you want to, just pause at this point and think about your own project. Is there already a program in place? Do you know of? And can you collect everything that you can that will help you? What do you think that you can? What do you think you can collect? So, what do you think that you'll have available that could define the challenge? That will help you understand who is involved and understand what's already been done for workforce governance. This is the sort of stuff you need to collect in advance. So just think about that before we move on to the next bit. So, scoping and mobilising. Key bit here, first step, define the challenge. We need to work out what's going on. If you're going to define the challenge, you need to think about a few things. Purpose, scope, who needs to own the plan of work, who needs to be involved. And there's a whole range of different things to consider here. So what is the purpose? What change is needed? How do you know that this is the change that is needed? What challenge do you have? What problem are you trying to solve? And think about the impact or the benefit of the change versus the impact of doing nothing. So this is all about what are we actually doing this for? And you need this for a number of reasons. First thing is you need to make sure that what we produce meets what we need. Okay, so if the problem is we haven't got enough nurses, it's too expensive, we are not providing access to patients, they're all very different, because if it's we haven't got enough money, well, we know that our solution's got to be cost neutral, better than cost neutral. It's got to save a certain amount. If the problem is a small one, we know it's a fairly small project to deal with. If the project's a big one, we're 1,000 nurses short, or 1,000 GPs short, or 1,000 care workers short, well, it's going to have to be a much bigger project. So, and we need to understand what's the point. Why are we doing this? Because if it's a really big problem and the impact is huge, well, we should expect a lot of help from people. We should expect people to put their effort into it. If we're short half of a person, then it's not really one we want to spend a huge amount of effort on, probably, and then not necessarily one that we want to engage hundreds of people in and a multidisciplinary workshop. So we're looking at the scale here. We're looking at why we're doing this and just trying to get beneath the skin of that. We need to understand who and what is in scope. So we need to understand what organisations are in scope, especially if we're in a system. Does it include primary care or not? Does it include social care or not? Local authorities? Does it include care homes? If we're looking at primary care, does it include pharmacists? If so, does it include the private sector, the public sector? Does it include the multinationals, etc.? It's the multiples. It's you need to understand what organisations are involved. Because we're going to need a lead for each of those, and we're going to need to touch each of those. We're going to need to know what services are involved within each of those organisations, which teams, etc. We're going to need that, what staff groups are affected or are particularly in or out of scope. And we'll talk a little bit later about exactly, it's equally important what's out of scope and what's in scope. We need to be covered. We need to know what we are actually trying to do. In this case, it's quite often worth looking at what's the input, what's the start that we're interested in, and what's the end? What's the end we're interested in? Both in terms of time, in terms of, what's the when will the project end and when does the project start? But also, at what point in the process are we talking about here? Are we talking about when it is referred from GPs, or are we talking about from the point of population need, etc.? There's a whole host of things to think about. What is in and out of scope? We're sort of jumping the gun a little bit to talk about the next two, but there's a lot of who needs to be involved as well. Who needs to own the plan of work? Who is going to do the stuff? Who's going to do what? And then who needs to be involved? So there's quite a lot, which we'll cover in a later step around this stuff. But it is about who is going to help, who is going to advise, who's going to be on the governance, who is going to be in the redesign group, who's going to help implement it. We need to understand all of the who's. Very, very important to get clarity around who's owning each area as well. So if you've got a workforce work stream that's covering administration and physios and rheumatology and surgery, you need to find out who's in charge of each of those, who's going to own the redesign in each of those areas, because you can't necessarily own the redesign in each area. You can help, you can assist, you can drive, but these people are the ones that need to agree exactly what's right and what's wrong. And getting them identified and in the right place to own this is going to be important. So, but we'll cover a lot of that in a bit. So you need to define the challenge. In developing the challenge, there's all sorts of things we need to consider, and I happen to have rattled through most of those on the last slide. So what are we trying to solve? Why are we trying to solve it? How do we know that we need to solve this? Are we sure that this is the problem needs solving, is one I haven't covered. And that's the one to think about is this A, the most important thing at this point, or should we be focusing on something else? But B, if we've got a shortage of if what's driving this is money, is that really a problem? In reality, is that what we really ought to be solving here, or is there a different problem we ought to be solving? Should we expend it beyond money to be much more about access? Is there a wider problem? It is always worth understanding, is this the problem that actually needs solving before you get into it? Because one of the biggest wastes is spending time doing something that doesn't need to be done. And as I say, what is the impact of not doing it versus what the world will be like when we expect to solve it? We'll talk a lot about Cotter later on, about building a vision. And this is quite important in terms of if we can bring people along by saying, look, it's going to be a lot better because of X, Y, and Z, then that's a useful thing to know from a purpose point of view. And then we've talked about the scope, the organisations, the people, the roles, the services, the patients. Not a group I mentioned, but absolutely critical to keep them at the centre of this work. What patient groups potentially are in scope of this project, and what is out of scope. Now, on the right hand side, you'll probably recognise this: specific, measurable, achievable, realistic, and time bound, the SMART objectives. And it is certainly worth thinking about, what are your goals, what are your objectives that you want to achieve through this program. And that means you need to be able to be specific about them, clearly state what's required. You need to know that they can be measured and make sure you've identified what that measure is. You need to make sure that people agree that this can be done. You need to focus on something that is realistic in terms of outcomes, and you need to set a timeline for achieving it. Thus, you don't just say we're doing this because we're short-staffed in an area. What we're saying is specifically what is required. We need to ensure that we have the right amount of staff to deliver the right patient outcomes. Measurable could be about patient outcomes, it could be about number of staff, it could be about bank and agency. We need to make sure it's achievable what we're trying to achieve. So making sure that our aim is to make sure that that objective is something that can be achieved, that has a realistic outcome, and we are saying when we are going to do it by. So in your particular case, it is worth thinking, can you identify what are the workforce related challenges? And then take each one of those challenges that you're facing for your project and think about each one. Why are we doing it? What's the evidence that that is a problem, so that we know it is the right thing? How do we know that this is the problem? And try and think about it. And then think about, what are the benefits of tackling this challenge? What are we going to get out of this? What is the difference between where we are and where we're going to get to? And then define those SMART goals. So thinking about it in a single sentence, can you define that we are looking to redesign MSK services to ensure, let's say, better access for patients. Specifically, we need to define what better means in terms of 95% of patients are able to be seen within 10 miles of their house. Let's define it that way. That's what we want to see coming out of this, and we want that to happen by 2025 or whatever. Let's set that out so that we've got a clear view on what we want to see. Let's not just say we want to improve access. We want to improve access by this much, by this time. And making sure that 95% is achievable and realistic and not something which is just pie in the sky and unachievable. So it's worth thinking about defining your challenge in each of your areas. So once you've defined your challenge, we'll talk about where you write that down in a bit, but once you've defined your challenge, the other key bit then is about engaging your stakeholders. And as I said, there are 4 groups for me that I think about. One is who's involved in the steering, the governance. Then secondly, who do we need to involve in a redesign group? So when we get to the redesign, we're going to need to get a group of people that know about the area, a representative from each staff group, the right people in the room to do the redesign. And we need to make sure that we've got the people involved in that group are ones that people will at least listen to. If you say to people implementation, oh yeah, we got Jeff, Sandra, Bandelli together to talk about this, and they go, oh, I'm not sure they know about it. Actually, you should have involved somebody else. You need to think about who would be a good redesign group, a representative group with the information and the clout and the respect, etc., that's needed that you're going to cover. So you need a redesign group. You also need a team of people to help you do this, because you can't do it on your own. There's a lot of work to be done. You often get, I split this sort of into 2 groups. Sort of one is advisors and one is doers, I guess. And as I said, I think I've said it before in a course, is that I've had a client say to me recently, there's a lot of people watching from the balcony and not a lot of people on the dance floor. And I think you do need to make sure that you have got capacity to deliver this work. And then finally, you need to make sure you are engaging the wider stakeholders for implementation and redesign. There's a whole range that you might want to think about engaging now, so that you don't have problems later on. You want to engage them now because you want to get the right people in the room at redesign to make sure you get the right answer out the other end of it. So there's quite a few things to consider on that left-hand side. So the first is who's needed for the steering group in order to ensure buy-in. So who are the key people we need to include on that steering group? We need to understand who's going to chair the steering group. Then we need to think about who are the right people to get things done, and who are the experts who will know what's already going on. The key thing here is to avoid not involving people and then just missing stuff that's been done. I think, if you look like an idiot if you end up presenting something that you've done which somebody else has already done, and it looks even worse if you then end up with a different picture. So absolutely finding out experts who know what's already going on is certainly worth engaging those at this stage. And you need to think about who needs to be involved in the redesign, as I said, the stakeholders and the experts in that group. Then you need to think about a few things. Am I representing the diversity of my workforce and my service users? And that is absolutely critical. Have I got enough local authority representation? I mean, I'm guilty of this as much, probably more than anyone else, but it's about, health is such a fragmented sort of provision and commissioning system that we often end up with about 20 health people to 1 local authority person, and we need to make sure that local authorities are included when needed and that they have the right representation in that room. I mean, that can be true of all sorts of groups, but local authorities is one to think about. And the other key one is to think about carers, volunteers and service users. I mean, I've used the dash there, but they're 3 different groups really. Patients, service users, there's a whole lot of challenge to engage in patients at times. All sorts of individual issues you can have around people just talking about one specific agenda, etc. You can have issues. How do you find a representative group or somebody to really represent patients? But if you don't engage patients, you are not engaging your service users. You're missing out on the richness. You're running the risk of people not really thinking about patients in the redesign, and you've got no credibility when it comes to implementation. So for me, engaging service users is always a boon. It's always needed. Yes, it can be difficult, but it's absolutely important. And the same is true of carers and volunteers. Just because they're not paid doesn't mean to say they're not important. And working out what role these groups could actually play may stop you making poor redesign decisions. So, thinking about how you engage those sometimes difficult to engage groups are critical. We need to think about, do we have reps from all providers, or, when we say reps from all providers, who represents primary care? Lots and lots of individual practices. Who represents care homes? Lots and lots of individual practices. How do we get the right representatives for those? Then we need to know who's going to deliver it, which is probably slightly different, slightly the same as who are the right representatives to get things done, but it's important, so we can mention it twice. Who can help us with all this work? And then also, who will this program report to? Who can solve these problems that we come up with? Who's making sure that it fits with a wider project? So blimey, there's a lot of stuff to think about from a stakeholder's point of view, and we really do need to get a clear view on who the stakeholders are that we need to engage. I haven't even talked there about getting into the detail of understanding who's likely to be a blocker and who are difficult, and politically who do we need to engage at times. If you're engaging nurses, are you engaging all nurses, or are you just engaging one group? This is something which you can really get into the detail on. The key thing is, let's get the right people set up from the start to be involved in this project, so we've got the right help and the right experts. One key thing is you need to form your project team that gives you the skills and the capacity to carry out the task for your challenge. Capacity, the need for getting more and more people engaged in helping it. This will help. So you need to form a project team that has the necessary skills and capacity, and you need to think about them wider than workforce. So if you're just a workforce team, if this is a workforce stream of a redesign project, then great, you're a workforce team. But I would always want to make sure I'm working in a team alongside digital, alongside business intelligence, alongside finance, and any other groups. Could be clinical groups, could be operational groups, could be estates, could be whomever. I always want to work as a team rather than working on my own, because workforce can't be done on its own. And if you operate independently of finance, you might find out that finance have got a different view on the numbers from you at the end, or you haven't collected the information finance need. So forming a project team, whether whether the workforce team is the focus for that, or whether you are operating within a project team, you need to make sure you've got the right roles in the room and you're focusing on this. As I said at the start, this is about being a project, and that's what this is really about. Now, there's a few things to think about in terms of stakeholders and how you engage them. This is a fairly standard model. If I've stolen it from someone, I need to work out whose it is. But it is a fairly clear 4-box model based around interest and influence. If somebody is a particularly high influence and they are very, very interested in what's going on, then you need to manage and work with those people very closely. If they're interested and influential, from a management and communications point of view, those people need to be engaged in the program. If they're interested but they're not particularly influential, you need to keep them informed. If they're influential but they can't really be bothered, you just need to make sure they know what's going on and are satisfied with it. In some respects, on the bottom right, the keep informed, it's more about communicating with people. On the top left, it's really about getting agreement and just making sure they know what's going on and have a chance to intervene. And if they're not interested and they're not influential, well, you can tell them what's going on, but you don't need to spend much time in terms of giving them a view, because they're not interested and you don't need them to help. So why would you spend a lot of time? When you're coming up with a comms plan, you think about the questions. Who am I communicating to? What am I communicating to them? Why am I communicating to them? How often? When? How often? When do I communicate them with them? And how am I going to do it? Am I going to do it through a broadcast, an email or whatever else? Am I going to do it through large meetings, fora, whatever? Are we going to do one-to-one meetings, or am I going to use various other techniques that you may be able to come up with from a communications point of view, including various online opportunities, whatever else you've got. So you need to think about those different elements. So in each case, you're thinking, who am I doing? And you just build a plan that just says, right, every week I'm going to communicate this way with these people, and this is why I'm doing it. So you just need to develop that communications plan as you engage your stakeholders, because people will move in and out of different things. They'll get more and less interested, etc. But I think when you've got a bit of a plan as to how you're doing it, you are at least making sure that everyone is kept up to date with what's going on in your project. So if you're looking at this as your own project, you need to build your team. Now you can go back and look at each of those questions, or you can answer these questions here. Who's going to do the work? Who have you got involved in it? Who are the experts we need to engage? Who are the people who need to be in the redesign group? What's the wider group of stakeholders that might be affected? Patients, wider staff groups, other staff groups, other organisation groups, and who is going to get involved in the steering and the governance. So from that, you should be able to develop what's your steering group if it doesn't exist already, who is going to do the work, who are the experts, and who are those key groups. And it's certainly worth doing that. As I say, you may be doing this within an organisation or within a project already, in which case the steering may largely be set already. Even the experts that are involved in the other streams will probably be the ones to engage. But who's going to do, who needs to be in your redesign group and your wider group of stakeholders, those may be a specific workforce question, or may not. Cool. So you've had a good go so far. You've thought about your scope. You've thought about why you're doing this project, and you've thought about who you need to get involved. Step 3 is to write it all down. We record things in a project charter that looks a bit like this. If you Google project charter, there are loads of them out there, and I really don't mind which one you use. You may have your own one. You may want to use this one. To be honest, our one I don't think is entirely perfect, but it does the job. And you write it down. And the reason why you write it down is because if you write it down, people will know what they're supposed to be doing, what their role is. They can agree it. And one of the biggest things I do when I'm workforce planning is write things down, because workforce planning gets complicated, and the more you can write down what the plan is, what the scope is, why we're doing it, who's involved at this stage, the more you can write down what the current situation is, the more you can write down what the planned future situation is and what the plan is for implementation and model it. The more you write down, the more stuff is there for people to agree or disagree with. If you don't write it down, then people cannot have a single way of identifying what the situation is at this point. So this step 3 could just be called write it down. You can use this. I think the project charter is available on the WRAPT website if you want to download that one. But basically, you write down everything you've covered. What are your SMART goals and objectives? What's the problem that you're trying to deal with? What's the scope? What's in and out? What's the start point? What's the end point? In this case, on this here, what we're defining is who's doing what. So what's the project doing and what is the WRAPT team doing as a separate group? But there's a whole host of stuff. You just write that down. You write down what the objectives are and the benefits you're trying to achieve. You write down who the team are and what their role is. You write down the any objectives that you've got and the milestone plan that you have. You can also write down your communications plan. You can write down all the list of people that are engaged. Just write it all down somewhere so you've got a clear view on your project charter. And as an activity, why not write your project charter and then use it as the basis for discussion at a steering group meeting? As I say, because you've written it down, other people can throw rocks at it, and that is great because then they can change it, and then you write down the changes, and then you've got an agreed understanding, or at least you've written down where people are disagreeing it. So you can ask them, have we got the right people or not? Is the scope right? Are the goals smart? Are they clear? And if they're not, you can change them. So excellent. Assuming you've done that, let's move swiftly on to item 4, which is the joy that is information governance. Information governance is an interesting one. So I used to be the CIRO, what the S stands for, something like Strategic Information Risk Officer for my organisation. You can get Caldecott Guardians, you can get all sorts of different roles associated with information governance. The key thing is information governance. If you are going to be collecting patient or workforce data, which you are, you really want to be engaging with the information governance leads in organisation, in the system and in each organisation early to understand what you need to do from an information governance point of view. So you do need to think about what data do you need, and this might mean you have to do sort of the next stage in terms of thinking about what data you need first, and you need to think about why am I collecting the data. Now, information governance in reality basically means that you must have a reason to collect any data that you're going to use. You've got to process it safely. You've got to be able to have plans to delete it when you don't need it anymore. I think there are 8 separate requirements which your information governance leads can help you with. Or you can Google. But the real key point here is engage your information governance leads early on, because these guys will have lots of information governance requirements to sign off on, and if you can engage them on a human basis about what you're trying to achieve and get their advice on what needs to be done, you can do the minimum that you need to do and get it done and get them to sign it and authorize things, rather than it being I've sent them an email which they just might not answer and then you have to chase, etc. The key things are you need to agree the data requirements. You need to be careful about what you're trying to collect. You need to identify who is going to be, the information is going to be shared between. So you need to think about the different organizations realistically. I would think about the teams within those organizations and think about especially third parties, and think about, are you going to be sharing data with lots of different groups to try and keep the numbers down. So for example, do you really need to share the data with all practices, for example? So you need to be very tight on who you're sharing it with, and you need to think about anyone that's helping you, consultants or sort of one-man band outfits who might be helping you with some of this stuff. You need to make sure we're very clear on all the people that are going to be sharing data. And then you need to create data sharing agreements, and you should use the data sharing agreements as set out by your organization or organizations. There are some online, so you can see examples, but realistically what you're doing is saying this is the data we're collecting, why we're collecting it, when you're going to get rid of it, how you're going to store it, or the requirements for storage, when you're going to review that and deal with it, and then you need to get sign-offs done. There are various mechanisms for getting sign-off. Information governance is a topic of complexity. Key takeaway is engage an expert in information governance within your project team who can engage the others in getting this done, because information governance can hold a project up for a year if you're not doing it right. So make sure you are getting help early on. Cool. So those were the 4 steps within it. I think I've just identified I probably need a summary slide there, but given we don't have one, key things are 4 steps that we've been through. We've talked about making sure that we understood the scope and all the objectives, and we looked at the SMART goals. We looked at the team we needed to engage and all the different people we needed to engage. We looked at the need to write everything down in a project charter, and we needed to sort out information governance. So if you've done that, you've got yourself ready, then you'll be ready next for data collection. So think about your next steps, a few things to think about. Feel free to register to the WRAPT tool if you haven't already done so, and have a look at that on that website there. You can buy the Bumper Book of Health and Care Workforce Planning, which will be available in May, June 21. I say May, June because it's the 12th of June when 12th of May when I'm recording this, and still got a bit of editing to do. But that'll be available on Amazon and includes everything you need to know on redesign, planning, hubs, etc. You can visit the WRAPT website, which is separate to the WRAPT tool. A lot of stuff on there based around this approach. Or you can visit the Health Education England workforce planning pages and access their Skills for Care's, Skills for Health's 6-step model if you are in healthcare. Or you can visit the Carados website. You're already on the YouTube, and if you are on YouTube, I'm probably contractually obliged to ask you to ring the bell, possibly, share, like it, comment, I don't know, advertise it to your friends, etc. Please feel free to do so. But the key thing is, hopefully, you're going to continue with the redesign course at session B2, where we are going to document the current state. So that should be exciting. Or you might want to dip into the data course, which will be X1, I think. You'll also might want to start the WRAPT Plan course if you're excited about workforce planning and want to start 2 at a time. They're a lot shorter. The WRAPT Hub course and the WRAPT Frontline course, much shorter than the WRAPT Redesign course. You might want to have a look at those as well. So good to go through that with you. Hope you found it useful. Leave any comments and look forward to seeing you at session B2, documenting the current state.